Hi everyone and welcome to At Home with QENDO, hosted by Dr. Maria Boulton and Dr. Fiona Raciti. We're about to get started. There could be a couple more coming on, but we'll just let them come in. If you have any questions for either of the doctors during this time, please write them in the message box and I will share them as we go. Dr. Boulton and Dr. Raciti, if you would like to start, that would be great. Thank you.
Hi, can everyone hear me? I'll take that as a yes. So my name's Dr. Maria Boulton. I work with Fiona Raciti at Family Doctors Plus in Windsor. And Fiona is actually at the moment trying to settle her baby, so she'll be with us soon. And we have been working in women's health for some time. I've actually been a GP for 16 years. And yeah, our bread and butter is women's health and COVID at the moment. Coronavirus is everywhere, of course, and please feel free to ask any questions. We can't go into too many specifics, and we always ask that you see your GP for specifics, but I'm happy to answer everything else. Thank you.
All right, so the first question that I've had sent through tonight are, what are the current Medicare changes and what do they mean for patients from a GP perspective?
So the current Medicare changes is that Medicare has released Medicare rebates for telehealth items, and you don't have to have a fancy phone or a computer. Basically, even just a phone call will do with your GP. And depending on your age and medical history, you will get access to Medicare rebates. And once again, depending on your age and your medical history, the phone calls may be bulk billed. It all depends on specifics, like, for example, if you're under 16 years of age, if you're over 70 years of age, if you have a Commonwealth concession card, or if you have any condition which puts you at increased risk of COVID, your phone call will be, or your telehealth will be bulk billed, so there will be no cost to you, provided you have a Medicare card. If you don't fit into those categories, depending on your GP, there might be a gap fee, and that really depends on your GP. Like in normal times, you know, if you go into a clinic, some clinics charge a gap because they spend a little bit more time with you. Some are bulk bill clinics, so that's always been the case. And yeah, so it just depends on your specifics.
Okay, so the next question is, with gynecologists in hospital not doing elective surgeries, how can a GP help?
A GP can help you a lot, and I think at the moment what we're seeing is that people are not contacting their GP. I think that they think that we're too busy, or they think that someone else is worse off than you. And what a GP can do is, for example, when it comes to endometriosis, is at least give you a clinical diagnosis. If you have pain, for example, talk you through what the diagnosis might be. They may be able to help with pain relief. They may be able to help with maybe some people who have chronic pain need help with psychologists, etc. They will be able to help you with that. And I heard whispers today that the hospitals are looking at starting their elective lists again, category 1s and 2s, and certainly it won't be too long before the rest of the surgeries are open and people can access them. So certainly it's worthwhile talking to your GP because there is a lot we can do to help you.
And on that note, with the allied health referrals, now some of us are under the understanding with the chronic health they can get the EPC referrals. What is the process to get an EPC and the category you have to fall under to get those referrals to allied health?
So that's a great question. Endometriosis, if you have a diagnosis, is a chronic condition. So you are able to access a chronic disease care plan. And by that, it means that basically Medicare will subsidise 5 allied health visits for you in 12 months. They may not pay for the 100% of the visit, but they will pay for some of it. And at the moment, you can actually access those chronic disease care plans on the phone. So you still have to speak to your GP, and your GP will do the care plan with you over the phone. Sometimes they'll have a nurse involved, and then they'll discuss whether or not who you want to be referred to. So, for example, with endometriosis, those referrals could be for a pelvic floor physio, or to I don't know, to people like a dietitian. The other thing is you still have access also to a mental healthcare plan. So for that, you can access a psychologist. You can have 10 visits a year, a calendar year, which is great because it means that those visits will be subsidized. And a lot of allied health, so for example, physios, dietitians, psychologists are also doing telehealth. So if they don't need you to come in face to face, they can help you over the phone or over telehealth, which makes it really, really easy. And I know for a fact that a lot of psychologists at the moment are bulk billing, so there's no out-of-pocket costs for you. The important thing is that at the moment, those rebates for telephone calls and telehealth will be available for at least 6 months. So you can rest assured that while this pandemic is going on, and if you don't want to go out and put yourself at risk, that you can at least access medical care over the phone.
So not only for our chronic diseases, but everything in general, when would you suggest contacting our GPs at the moment for appointments for telephone versus in-house consultations? How do you make that call?
Yeah, so your GP can help you make that call. We are a clinic. We are asking everyone to call us first, and basically you just speak with your GP, and then if your GP can sort it out over the phone or on telehealth, then we will do that. And if we can't, then we'll ask you to come in. Now, rest assured that we're taking every precaution to make sure that everyone that comes into the clinic is triaged. So they will be asked questions as to whether or not they have any risk of carrying coronavirus, at least twice. And if, depending on how they answer those questions, we may not see them inside the clinic, we'll see them next door, which is where we're seeing people that may have some symptoms. For everybody else, we're keeping the clinic nice and clean and safe. So basically the procedure you would do is, first of all, don't be shy. I think if you're worrying at home, the worst thing you can do is wait, because what happens during pandemics is that people will not only die of the virus, but they will die out of everything else more often because they're not getting the medical care that they need. So I think if you're concerned, just pick up the phone, make an appointment with your GP. Your GP will be able to sort out as much as possible over the phone or telehealth. And then if they can't and they need to examine you, they'll ask you to come in. But like things like we can do referrals for blood tests, we can do referrals to gynecologists, we can do referrals for ultrasounds. We can also send scripts to your pharmacy, so that there's a lot of stuff that we can do now over the phone without you having to set foot outside your home.
So one that's just come through now is someone that's about to have to find a new GP, and they're just asking about how do you choose a GP and know that they know the endo, their, you know, their diagnosis. Yeah, I don't know whether that makes sense, but
yeah,
how do you know what their knowledge base is, and when, like, kind of when do you get a second opinion if you see somebody?
Yeah, look, I think QENDO does a great job in letting you know what GPs have an interest in endometriosis. I think too, it's like going to the hairdresser. Not everyone that goes to a hairdresser will come out with a good haircut. So even if your friend says, oh my God, that's the best GP ever, and you don't have a good fit with them, then you just need to keep looking. But I think word of mouth is not too bad a place to start. I think QENDO does a great job too. I think also maybe doing a little bit of Googling and making sure that when you look them up on their profile, they have said that they have an interest in women's health. It also helps if they have worked in a women's women's clinic, because you know that they've had a lot of exposure to women's health. And I think you can also come and interview them, like just ring them up and say, hey, this is me. These are the problems I have. Is it something you have experience with? And I think it's a really good question, because sadly, the average time from when people become symptomatic with endometriosis and get diagnosed is 7 years. And that's because people either, I think people sometimes, they have bad luck in that they end up seeing someone who doesn't know anything about endometriosis. And I think that it is worthwhile doing a bit of research first. I think, hey Fiona, I think that the same applies to gynecologists. I think us GPs, we know a lot of very nice gynecologists who are really, really good with endo. But once again, if it's not a good fit, you just need to let us know. I wonder if Fiona has anything to add about how you can find a GP that can help you with your symptoms.
I agree with word of mouth and personal recommendation is a good place to start, and looking at places like QENDO who have recommendations. But I do agree that it's a bit like finding a hairdresser. That's a pretty good analogy. Sometimes you've just got to meet somebody and try them out and see if they resonate with you. Particularly with endometriosis, I guess, where there's lots of different approaches to it, and everyone's got their own ideas about what is helpful and what might be good for your symptoms. So I think meet somebody, have a chat to them about what you're looking for, and don't be afraid to try a few doctors if you're not happy with the first person that you meet.
Okay, so questions from the floor. If you've got any questions for Fiona or Maria, please write in the comments. I haven't seen anything come through. Oh, here we go. Following on from finding a new GP, what makes for a good patient? How do I make a good impression and get taken seriously?
I'll start with that. I don't think you should worry about what impression you're going to make. I think that if you have a good GP that listens, I think that they will take you seriously. And it's like when I was talking to Fiona about this today, that some parents sometimes when they have a baby and the baby does a poo that's green, they'll take a photo of the poo and they'll bring it to you, or they'll bring the nappy in with you, and it's okay. Like, I believe you. If your poo is green, I'll take your word for it. And I think that that's you've got enough things to worry about. You don't have to worry about what sort of impression you make, because we see lots of people through all different stages, and we don't want to put any more pressure on you. Fiona?
I would agree. I see a lot of patients who say to me, oh, I don't know what to ask, or I don't know what to say to the specialist. I think don't worry about it. I mean, that's our job, is to try and find out what you need or what else we can do to help you. So I guess I would just say come in and tell your story, and then sometimes it evolves from there. And it's our job to try and work out if we can do anything else, not your job to tell us what you need. So just give someone a chance, and I say tell them your story rather than worrying about questions to start with. That would be my best advice.
What process would you follow if you had someone come in with something that you suspected was either adeno, PCOS, or with fertility troubles?
Fiona, did you want to take that one?
Yeah, sure. I guess it depends on. I always like to start from the start and find out, like, take a good history and find out where they've been and what they've done before. Sorry, Maria, you might have to take over.
Yeah, so I guess the process it's really simple. We take a good history. So we ask you about your symptoms, and and about anything that's worrying you. And we basically let you talk for a bit first, because a lot of it comes out when you first speak with us. Then we will take a full history. So we'll ask you not only about you, but maybe about your family, you know, your mom, your grandma, your grandpa, etc. We'll ask you about your periods. We'll ask you about your pain. We'll ask you about any other symptoms that we think maybe has been left out. We'll ask you about what you've been through before and what you've tried, and what has worked and what hasn't. Then we'll go through and examine you, and you know, a lot of the time that doesn't really involve an internal exam, so you don't have to be scared of that. And then we might talk about having some investigations, and a good GP will also know where to send you for an ultrasound. So ultrasounds are really essential with things like endometriosis and PCOS. And yes, a lot of the time we can't see endometriosis on ultrasound, but there are some places that do a really great job. And if there's a chance that we'll see it on ultrasound, we'll send you there. And then I guess we'll bring you back and for another visit. And I think it's really important that you always go back or call your GP and talk about your results, because then from then you make a plan as to what you do next.
And I guess what probably what I'd say too at the end is it depends a little bit on what you want. So some people just want a diagnosis and they just want to know like an answer, I guess, for a lot of their symptoms or problems. Some people, you know, fertility is a concern, and so that might become the focus of the investigations even, or the discussion of management. Some people want pain control. So I guess, you know, we can target really, not everyone kind of ends up with the same management or the same approach. It depends on where you are and what you need with your symptoms. So I think it's really important you have a personalized approach to it and make sure you're treating the patient and the person in front of you, not just kind of a cookie cutter, this is PCOS and off you go, or endometriosis for that fact. And I agree with Maria, like a good GP will know where to send you for tests, but also for allied health, you know, if you need some physio or you need a pain specialist, then somebody who's got experience with it will know the right people to put you in touch with if that's needed.
Any more questions, anyone? Just through the question box if you can, don't be shy.
I think too, the main thing is just not to be afraid to ask. Like, you know, if you do have any worries about anything, and it doesn't matter how simple you think it is or whether it's the wrong question, I think it's really, really important that you talk about it, because endometriosis, PCOS, infertility, I mean, it can be associated with so many symptoms. And yeah, and the other thing is knowing that you're not alone, and this is where QENDO comes in too, to give you support and let you know what sort of specialists you can access to, and you know, find a little bit of help with dealing with pain, etc.
I would agree with that actually. So I guess a little bit of my own personal story, I have both PCOS and endometriosis, and I know about both, and I'm a GP, and I still actually had to struggle to get the right investigations and get referred to the right specialist. So even somebody with knowledge can find it challenging, but I guess if you keep asking or make sure you keep kind of making sure you get your questions answered, I think is really important. So if you don't be afraid to ask the question, don't be afraid to ask for another opinion if you don't get the answer that you're looking for, whatever that answer might be. And just keep going, and eventually you'll find somebody who's able to help. So don't be scared to ask. Agreed.
And the most recent question, are you taking new patients?
Yes, we are taking new patients. I'm taking new patients. Maria can answer that for herself, I guess, but certainly at our practice, we're taking new patients and we're happy to see anybody.
So for myself, because I'm immunosuppressed, currently I'm working from home. We do have 11 GPs working at our practice, and so at the moment, because I can't examine people, I'm not taking new patients currently, but Fiona is, and we work with lots of GPs that we've handpicked, and basically they have the same ideals, and yes, we're still taking patients.
Any more questions, anyone? In the question box, you can change it so that you're just sending the questions to me if you don't want everybody to see them as well. Now, Fiona and Maria, after tonight, are you happy if these guys send me questions and I can forward them on to you guys for advice or answers or what have you, within reason?
Yeah, of course. Happy to.
Alrighty. Anyone else for questions? Okay, another question. How much do you believe physios help for endometriosis?
I can take that. I am a very big believer that physios can help. I guess I've seen a lot of patients with endometriosis that end up with chronic pain because they haven't been diagnosed early enough, or they haven't, I guess, had the right advice early on. And sometimes those patients are left in a situation where all people can offer them is medication, which I don't think is always the right answer. Because these are young, otherwise well people who end up on strong painkillers for sometimes reasons that they don't have to. I think it's really important that you make sure you see an experienced physio though, because there is nothing worse than kind of finally either plucking up the courage or committing to spending the money or whatever it is to see a physio. You see somebody who's not experienced and you end up kind of know better. I think that kind of really puts you off from accessing good help. And there's some excellent women's health physios around. You just got to know who to see. And I think they can be really helpful. Also, I guess something that people don't talk about a lot is the sexual dysfunction that comes with endometriosis and pelvic pain. And they can be really useful in that situation too. Sorry, it's difficult in isolation with no help for babies.
I agree. I think physios are really, they do have a role to play, and I think that that's where that chronic disease care plan comes into, because that can give you subsidised access to a physio. But once again, going to someone experienced, which is really easy if you're in Brisbane, not so much if you're regional areas. Similarly with accessing GPs in the regional areas, sometimes depending who is on at the clinic, and sometimes you'll get locums that don't know much about women's health, and that's really terrible and it's really bad. But at the moment where you can have access to GPs on the phone, I think that everybody needs to take that opportunity up, especially the regional areas.
Okay, another question that's just come through. Do you have any advice for women experiencing endo-adeno PCOS that live remotely?
So we've both worked remotely. I used to work in Mackay and Fiona used to work in Bundaberg. And I think that you really look, especially with if you're going to have surgery, the first surgery for endometriosis is really the key. So you might have to maybe consider investing in coming into a bigger town like Brisbane. But certainly, you know, you can access help on the phone. And Fiona and I have both had patients that live remotely. Like I have a patient who lives in Mongolia at the moment, and we do a lot over the phone, and she comes in maybe once a year, and we sort out anything that needs to be done face to face. But I think that, you know, living remotely makes it really difficult, but as long as you can pick up the phone, you can get some help.
I would agree, and I think now's the perfect time to do it when you know, everybody's doing phone consults and telehealth as part of their normal. So it's now is a good opportunity to try and link in with somebody. And I think this is going to be the new way we practice anyway. But it's a good chance while there's some Medicare rebates and people are available to do that. Same with physios. I think there's a lot that physios can do over the phone without necessarily having to do an examination. I mean, that's always helpful and they can certainly guide you, but I agree that living remotely or regionally doesn't preclude you from getting specialised help. It just might require a bit more logistic support, I guess. But definitely pick up the phone and don't be afraid to have a conversation with somebody to start with, and they can guide you about what you can do to access more help locally or to come and see them.
You can also access, if you talk to your local, so if you're in a small town, say for example, I don't know, Claremont, and you need surgery for endometriosis, then you may be able to speak to the Director of Medical Services and get some rebate for your travel and accommodation costs if it's surgery that's not provided there. So that might be able to help you out if you need a little bit of financial support as well.
Thank you. Now, the next question is, would it be helpful to send your reports to your previous GPs or gynecologists after receiving an official diagnosis? What is the best way to go about it if they have previously dismissed your pain?
Fiona?
Yeah, that's challenging. I guess never really been asked that. Probably my thought would be, I don't know if I would expend the energy doing that. I mean, I can understand from a patient perspective the frustration that you might feel if somebody's previously dismissed you or not heard you or not referred you like you've asked, or kind of not come up with a solution for your problem. But I guess my thought would be to not expend a lot of energy and time and emotion on kind of pursuing that. I mean, certainly if you want to let them know, I think that's pretty harmless, but I'm not sure that it's going to help kind of you move forward from the diagnosis. And I think probably the key is making sure you have a GP or a specialist that does listen to you and does support you and that can help you in the journey, and kind of try and expend your emotional energy that way rather than, unfortunately, GPs and doctors are like any other person, and there's some excellent ones around and there's some ones that give everyone else a bad name because they don't care or they're not educated enough. And I just don't know that it would give the solution that you want by trying to pursue that pathway. And I think you're better off trying to find somebody who is going to be helpful for you on your journey. I don't know if that's the answer that people want to hear, but I guess that's, from my perspective, what I would encourage my patients to do.
No, I tend to agree. I think if you wanted to give feedback, I don't think that you're going to lose anything by doing it. But once again, I agree with not spending energy with people that didn't listen to you in the first place. I think that that's probably energy wasted. I think that probably maybe just a short phone call or whatever, just to make sure that they know that they got it wrong, so that hopefully they won't get it wrong again. But whether or not they listen, that's the other thing. And I think maybe spend your energy maybe passing on a bit of your knowledge. So maybe next time you come across someone who has your symptoms, maybe you can say, hey, you know what, I found a really good doctor, go and see them. And I guess spend your energy passing it forward, I think, helping others.
Agreed. And I guess that's where places like QENDO and other kind of social media forums are really good, because that's where a lot of people go for their advice and recommendations on who to see. And you know, unfortunately we live in a world where Google is everyone's friend, and that can be really helpful, but it can be really harmful. But I guess if you can expend your energy and try and promote the good GPs who are out there and the good specialists who will listen, then hopefully you can try and help somebody else who's kind of on the journey and is seeing somebody who's not very helpful. I think that's a really positive thing to come from an experience that maybe has not been so good, is trying to help somebody else not have that same journey that you've had.
And I guess, of course, I mean, if a previous doctor has done a real terrible job, then there's avenues for you to complain as well. Bearing in mind that, you know, that will take some energy too, but, you know, if you feel really strongly about it and you feel that that should be part of your journey, then, you know, then put a complaint in. As you would with a hairdresser who does a terrible job, or I hope you would anyway, but I know I have. Yeah, I guess it's whatever you feel you should do in the end. But I guess don't waste too much energy in the past. Focus more on the future.
Thank you. Is there any more questions from anyone? Alrighty then, we might call it a night. Oh, hold on, sorry, one more. Great answers, thank you. Sorry, I should have clarified that it was purely from feedback educational perspective. That was just from the last question. Alrighty, so we might call it a night. Thank you, Maria and Fiona, for your time tonight. And if any of you girls need any support, please don't forget about our support line. We still have someone on call 24 hours. You leave a message and we give you a call back, or you can send us a message through Facebook and we can reply. And any questions for Fiona or Maria, please email us and we will forward them on. But thank you everyone for coming.
Thank you.
Thank you.